Okay, thank you very much, Mr. Chairman. Ms. Counsel, you talked a little bit about upgrading your medical record system. If y'all's electronic medical record system were in the private sector, would it be compliant with all the laws applicable to the private sector? The HIPAA laws and all the other new requirements under the Affordable Care Act?
Not all the new laws.
Could you turn your microphone on?
Sorry, I forgot about that. Not all the new laws. That's one of the reasons that we are developing a new strategy for what we need to go forward with for the next 25 years. So no, it would not all the ACA.
And it's also my understanding that a lot of both your hardware and software is grossly out of date. I was down in the Rio Grande Valley, and the Secretary of the VA mentioned to the group that some of the financial systems are actually running in computer language called COBOL, which was actually around probably before I was born, and I'm in my 50s. Is it a problem to maintain and update this code and find employees to do that?
The current state of the financial systems is that we're looking for a shared platform with our financial organization. They're looking at Treasury as a federal opportunity to engage and partner. So you're right, the systems are older. As a person in our 50s as well, and COBOL being a language that I know quite well, it is old, and we do need to upgrade.
And so what sort of effect is this out-of-date software having on delivering service to our veterans and making sure that the physicians who provide service, either under the voucher system or Veterans Choice, are paid in a timely fashion?
Yeah. I think you've touched on the main issue as to why we're looking at a digital health platform, sir. The reality is when you're on old platforms, old hardware, software, you can't take advantage of the new opportunities to share data as well as upgrade our information with those providers and pay them quicker. That's really our focus, to ensure that we're prepared for the future.
And it's not just the software that's out of date as well, or your custom software. It's even some of the stuff you buy off the shelf. It's my understanding y'all have not yet completely migrated off Windows XP, which is no longer supported by Microsoft.
Yeah, there's 834 custom applications within the VA, the most custom that I've had seen in my career. We also do have XP in the environment, much of that leveraged by medical, cyber, and medical equipment. As part of our enterprise cybersecurity strategy, we've put in processes to eliminate and drive out that life cycle problem.
Yeah, are we also looking in the VA at moving away from an extraordinary number of custom systems? I mean, there's a lot of off-the-shelf stuff that you ought to be able to adopt. Is that not a reasonable question?
It is a very reasonable question, sir. And there are 5 new functions we're adding as part of the strategy. One of those new functions is strategic sourcing, which is all about putting us in a situation where we buy versus build, so that we look for off-the-shelf software that could meet our needs first. We validate that there's not something that's already built that could meet our needs, and then we make those calls based on what's best fits the process.
All right, I can understand that there's some legacy stuff that was designed to run on Windows XP and may not run on other stuff. I mean, our research shows that y'all are still on Exchange Server 2003. That had an end-of-life support cycle in 2014. You think the outdated software that's not getting current security patches might be a cybersecurity opening or vulnerability?
We actually use the same assessing process that the IG uses and patch aggressively against each of those issues, as well as taking those software out. One of the big opportunities that we have, and we're be deploying within the next month, a contract to start moving much of this to the cloud. using email as a service, moving much of that storage out into the cloud in a secure manner, working with the IG. And it gives us an opportunity to eliminate some of the hardware issues that we have, but also put ourselves in a new place as far as transformation.
And I want to direct this final question to anybody on the panel that would like to answer it. Is there anything that Congress is not doing that it should be doing to help you through this IT crisis and get you to where you can better deliver services to our veterans? Obviously, the answer is maybe give us more money, but maybe we can do a little better than just that.
I always say this because it still continues to be the issue is, when you're hiring for information technology, the kinds of architects we need, the kinds of security people we need, we're competing against private resources. And it takes a while to get into the federal government, and the requirements are not those that those same resources and highly valued resources would face in a private industry. We need those resources, and even as we get access and views and opportunities to meet those people and talk to them, we take a long time to get them in the door. And so any help that can be given there will be the most important help you could give us.
And if you could get us some specifics on that, we want you to be able to compete with Google for the good people.
I appreciate it. I have 3 or 4 resumes I'll give to you.
Thanks. Does anybody else want to answer that? All right, then I'll yield back the remainder of my time.
Thank you, Mr. Farenthold.
Thank you, Mr. Chairman. So, Ms. Counsel, as CIO, the difference between a computer and a telephone is basically vanishing today. Did the telephone system fall under your jurisdiction or your leadership as well?
Currently, we provide the network capability, but we do not manage the phone contact centers or the contracts of those contact centers. The issues that are mentioned there, however, we are aggressively working with the new leadership. We have a new leader who put the 311 process in Philadelphia together, who is now coming in. We are making sure that we have the best capability. And I also know in that particular circumstance that was raised, that vendor who had voicemail now has had the contract updated, and there is no voicemail in that process any longer. So we support it. We're working with them directly. I actually meet with that contact center so that we can ensure that we have the best infrastructure to move us forward more aggressively.
So, yeah, I understand. The call center issue, this is not rocket science. This is technology every company of any size has, complete with the ability for overflow calls to potentially go to people's homes or cell phones. We talked about the case of scheduling appointments. There's also tragedies associated with calls being dropped or sent to a voicemail system that some people didn't even know existed on a suicide prevention hotline. And I would encourage you to work closely with those vendors because, again, I think the line between the IT system and the telephone system really isn't a line anymore, and we ought to be able to use the technology to make sure that no veteran calling for help with suicide has to wait on hold or have their call lost in voicemail. We also, I'm going to shift gears a little bit. I spend a lot of time in casework. About 70% of the casework I do in the district office, but the district offices that I have in Texas is VA related. Of all the entire government, 70% of our complaints and problems are with the VA. That, some folks in the VA need to be kind of hanging their head in shame on that one, I think. But we're spending a lot of time in our office trying to get doctors to work with the VA, see veteran patients under the voucher system or Veterans Choice. And we talked in our first round of questioning that y'all are working at modernizing that payment system. But what can we do now? I mean, is there anything that can be done now to get the doctors paid quicker so they'll see our veterans again? The local VA people say, well, here's help in filling out the forms. Here's how you fill them out right. And if it takes too long, call us and we'll try to push it through. But, I mean, you shouldn't have to call a senior person in the VA or call my office to have my red tape cutter call the VA. Do you see any, first off, when will it be fixed? And then, until then, is there anything we can do to improve the situation?
I actually will be happy to get some information to you. One of the things about IT, if we really want to be good, we have to know what our business partners are doing. And so I know that Dr. Shulkin and Dr. Bally are working very strongly to figure out ways that we can prepay for certain things, that we can expedite this process. It's all about a part of our access process that we need. We are also looking at proof of concepts around doing some things in the cloud with urgent care, and telehealth with urgent care, so we can see people the same day in many cases. So I'll be happy to get some information back to you exactly what they're doing, but I know we're aggressively making some decisions and prepaying in some cases so that this is not the problem.
We worked really hard in Congress to get the Veterans Choice Program implemented and provide quick care for veterans. But if you guys can't deliver on paying the doctors and they don't want to see them, and yes, obviously a lot of that is contracted out. You have different contractors, but we've got to find a way to get this done, because there's no point fixing these laws if you guys can't execute them and do that. So I would definitely encourage you to do that. And finally, we talked a little bit about some of the older systems, your email system, some of the Windows XP. Do you have a dollar figure on how much it's costing to contract for beyond life cycle support on that?
I do not, but I can get you that information.
All right. It would be interesting to look at comparing how much we're paying for that extended support versus how much it would cost to have somebody come in and upgrade an off-the-shelf, again, an off-the-shelf product that, pretty much any decent system integrator in the country ought to be able to put in. So I see my time's up. I appreciate your commitment and wish I saw the successes that I hear in your voice reflected at the local level. I'm waiting expectantly for that to trickle down so our veterans don't have to wait for the care that they need. Thank you.